Testing for immune function. The immune system is really your defense mechanism. It protects the body from infection. Your white cells, your antibodies, and other components in the blood, including the organs of the lymph nodes, they make up the body's immune system. So many disorders actually weaken the immune system and cause a person to become immunocompromised. So patients who have autoimmune diseases like chronic fatigue syndrome or Lyme or mold or SIRS, these are patients that would tend to have a compromised immune system. Patients who constantly catch colds and flus and cannot get better, these are people that would tend to have a compromised immune system. So to measure the immune system, one needs to measure the T helper 1 and T helper 2 cell, the ratio of 1 and 2. So that can be identified through a blood test, which is a cytokine panel, and it identifies your interleukin pathways, your tumor necrosis factor alpha, your TNF beta, TGF beta, etc. So all of these ratios of both Th1 and Th2 will give you an indication what's pro-inflammatory, what's not, etc. In addition to the cytokines, one can also have a look at SNPs, genomic SNPs for chronic inflammation. And these are particular interleukin pathways. So it either can be Th1 or Th2 pathways. There are other autoimmune antibodies. Sometimes your doctor might measure specific antibodies, for example, your inflammatory markers such as CRP, C-reactive protein, or homocysteine or ferritin. These are the standard ones. But then you might measure ENA or ANA or DNA, which is a double-stranded DNA. These are markers that will give you an indication if there is an autoimmune dysfunction in the body. Other autoimmune assessments can be a comprehensive one, which identifies not only antinuclear factor, which is ANA, but also identifies rheumatoid factor. That can be obviously measured separately as well. Your extractable nuclear antigen, which is ENA, the double-stranded DNA, which is dsDNA, smooth muscle antibodies. So if you've got muscle dysfunction, such as multiple sclerosis or MND, you might want to examine smooth muscle antibodies as well as anti-mitochondrial antibodies. So there's a lot that can be identified and rectified based on these particular markers. So if you'd like to determine which test is right for you, please speak with your healthcare professional, or you may want to contact us to order a test, interpret your results, or even seek guidance for your health condition. So to learn more, check out our Learning Center for in-depth education on this very topic.